super excited to be here at Health with the Truvian team. We're going to get to see the platform in action and then talk to the leadership team and also one of their investors about why they invested. Let's see the platform in action.
Great. So this is our benchtop blood analyzer. It's currently in development. And so today what we're going to do is do a little bit of a demo and show you how our comprehensive wellness panel works. So the first thing that we do is we collect a little bit of blood. We need 300 microliters to run the full panel. And it's a touchscreen interface. So I'm going to scan the patient ID, enter in the birth date, enter in the sex, and this individual is non-fasting. Then we open the drawer. It tells the user to mix the sample, which I already did, to decap that tube and to put it into the support pack. And then we place the support pack and the disc into the device. And you can load that consumable in any way you want, and then you press Start Test. So what's going to be running today is a comprehensive wellness panel. It has 34 different blood tests. It comprises a CBC, a CMP, a lipid panel, TSH, and then hemoglobin A1C.
Super cool. It must be so, proud for you two to be able to see the platform too, and you really did a great job, like I was telling you earlier, with the design, and obviously functionality is most important, but the fact that you also nailed it on design is a huge win for the team. So, tell me, why was it important to be here at Health this year for the team?
Yeah, absolutely, Jared. So we came to Health as a team, and we've got 2 booths here. And our goal was to not only be able to demonstrate and show our product, which is in development, late-stage development, but also show the art of the possible, which is really this booth here, where we are actually mimicking what an actual wellness center would look like in the future, where blood diagnostics is integrated into primary care settings, and now we can be that connector between primary care and the pharmacy through diagnostics being in the middle. We also wanted to showcase our product, and the clear case model there shows the product and how it's going to, how it's going to operate on the inside, which is critical compared to these systems that are actually demonstrating the product working with a hard case on.
This one, I guess, would be for both of you. Why is transparency so important in the space that you're in?
Yeah, we're in healthcare, and healthcare is primarily about us making sure that we can live better, healthier lives. So it's very important that we demonstrate and provide the best quality product, and therefore transparency is just foundational. It's a foundational pillar on which we built our company. Everything we do is not specifically done to indicate transparency. It's just how we operate. And so we've taken that to the way we develop the product. And this IRB approved study is also an example of that. So we are showcasing that we're doing this in a safe environment. We're following the protocols necessary to actually do blood testing in a setting such as this. And then we're going to ensure that as we put this product out into the market's comfortable with a blood diagnostic product such as this, considering that the market has had challenges in the past with blood diagnostics and blood diagnostic companies.
And how excited are you after starting the company back in 2015 to see the product and where things are at today?
Yeah, no, it's been really exciting, and I think this is a really pivotal year for Truvian because it's the first time we've been able to demonstrate that our benchtop blood testing analyzer produces results very similar, very consistent with central laboratory testing. So we presented a big data package at the 2023 ADLM conference back at the end of July, showing that we're consistent with central laboratory analyzers. That was a really exciting achievement. So now we've de-risked the technology, we've shown that it's capable, and now it's about finishing up our development, running our clinical trial, and submitting to the FDA.
Congratulations on all the success so far.
Thank you.
And I want to make sure this is unique because we also have one of your investors here. And one of the things we always ask every investor that we run into, right? What was it about this team? What was it about this company that made you want to invest?
Yeah, I think first the magic is seeing is believing, and they're solving such a fundamentally hard problem in healthcare that the mission of trying to improve outcomes and actually decrease costs at the same time was one that we couldn't just pass up on digging in. As we spent more time with the team, Jay, Dina, and the rest of the product engineering team, we, as Jay aptly put it, transparency was their way, is their way of doing business. It wasn't just something that was a box to be ticked. So that gave us a lot of comfort. I think aside from that, it's just the pedigree of the team of being able to not only do the impossible, but I also like to dub it as, the little engine that could. And what this team has done is such a Herculean task, not just in startup land, but I'd say in all of healthcare. And so we're just proud to be a member of that journey.
Well, congratulations to all of you. Like, this is so, I hate to use this word, but also so cool what you're working on.
Yeah.
And can't wait to continue to follow the journey and stay in touch with the team and see where things are at. And thanks for joining us here today at Health.
Thanks for
Thanks a lot.
coming.
Thanks a lot, Jared.